ALS is a type of motor neuron disease. As motor neurons degenerate and die, they stop sending messages to the muscles, which causes the muscles to weaken, start to twitch, and waste away. Eventually, the brain loses its ability to initiate and control voluntary movements. It is a rare neurological disease that affects motor neurons, those nerve cells in the brain and spinal cord that control voluntary muscle movement. Voluntary muscles are those we choose to move to produce movements like chewing, walking, and talking. The disease is progressive, meaning the symptoms get worse over time. ALS has no cure and there is no effective treatment to reverse its progression. ALS often begins with muscle twitching and weakness in an arm or leg, trouble swallowing or slurred speech. Eventually, ALS affects control of the muscles needed to move, speak, eat, and breathe. There are two main types of ALS: sporadic. This is the most common form of ALS in the US, making up 90 to 95% of cases. These cases occur randomly, without any known cause, and there is no family history of ALS. Familial. This form of ALS affects a small amount of people and is thought to be inherited. ALS may be inherited in 5–10% of cases, but the rest of the patients who contract the disease seem to do so at random. Most patients diagnosed with ALS do not have a history of ATLs in any of their immediate family members. Most people who develop ALS are between the ages of 40 and 70, with an average age of 55 at the time of diagnosis. However, cases of the disease do occur in people in their 20s and 30s. ALS is 20 more common in men than women. The Centers for Disease Control and Prevention estimate that more than 16,000 people in the United States have ALS, with around 5,000 receiving the diagnosis annually. Worldwide, it may affect 2 to 5 people in every 100,000. Risk factors for ALS include gender. ALS is slightly more common, tested source, is in men than women before age 65. This difference disappears after age 70. All symptoms most commonly appear in a person's late 50s or early 60s, but it can develop at other ages. Race. Caucasian, non-Hispanic people are more likely. Trusted source is to develop ALS, but anyone may develop the disease. There are two types of ALS: sporadic and familial. Sporadic ALS develops at random, and it accounts for 90–95 cases. There is no clear risk factor or cause. Familial ALS is inherited. Around 5–10 of cases are familial. The child of a person with ALS has a 50% chance of developing the condition. Rarely, it can affect a person in their teens.